Great. Yeah, so welcome everyone, for those we haven't said hi yet. And thanks for joining. This is the final webinar of the SRS learning series, so very excited. Over the course of the series, we have explored like a wide range of topics related to the design, implementation and sustainability of the sample registration systems. And today's session brings this series to a close by focusing on a set of systems that related products and resources that have emerged from the planning grant process. These resources have been developed by Maryam and Rohina, as you see in the pictures, to support countries in designing integrated, coherent, and sustainable SRS, and drawing on lessons learned and experiences across the grant countries. So today we'll have the presentation, about like a 45-minute presentation by our speakers. And if you have any questions, then you can post them in the chat, and we may have like 5 or 10 minutes of discussion. Yeah, so without further ado, I'll introduce the speakers to you. I think you both know, like many of you know already, Professor Rohina Joshi and Maryam Tavakkoli. Professor Rohina Joshi is the lead of the Global Health Research Team at the School of Population Health from the University of New South Wales in Sydney. She has extensive experience in health information systems, mortality surveillance, verbal autopsy, and medical certification of cause of death. And she has contributed significantly to strengthening mortality data systems globally. Dr. Maryam Tavakkoli is a scientific collaborator at Swiss TPH, and her work has focused on systems thinking, health systems, CRBS, and the design of integrated approaches to mortality surveillance. They will present the system-related products as announced, and I think I'm giving over the floor to you both. Thank you.
Thank you, Patricia. Hi, everyone. This is Maryam. Let me try to open the camera so I can say hi. Hi, everyone. Today, I'm very glad that we are here and we can present the final system deliverables. Well, actually, they are not finalized. Soon they will be finalized, but they are at the final stage. So we are happy to present them to you. I think first I will hand over to Rohina to give you an overview of the systems toolkit. And after that, I'm going to present to you some of the other deliverables on situational assessment, synthesis, and also the process mapping navigator that we developed. So there are 3 main topics that we are going to present, and hopefully you'll have time to discuss later today. So with this, I will hand over to Professor Rohina Joshi for her presentation.
Thank you, Maryam. And as I speak, I'm just going to start presenting my slides. Can you see the slides?
Yes.
Yeah. Perfect. Thank you so much. Hi all, and thank you for joining us today. My name is Rohina Joshi. I'm based at the School of Population Health at the University of New South Wales, and it's actually been fantastic working with the team at Swiss TPH and also listening into some of the discussions with countries. I've reviewed several protocols. So today what I'm going to do is just take us through this guidance document, and many of you would have will see it, will review it. But so this is a sneak peek into it, and hoping to get some reactions and some reflections from it as well. So this is, we've titled it Systems Toolkit for SRS, a Systems Lens to Design and Planning. And the idea is that it goes alongside the 12 steps of SRS design and planning, which is a fantastic document. So this just adds on to that particular document. So the objectives of this toolkit are to apply a systems thinking lens to SRS planning and design. So just, not just going step by step, but also understanding the ecosystem in which SRS sits by making explicit how the properties of complex adaptive system manifest across each of those planning stages and what it means to actually use and think through those in terms of practical design making. We also hope that this toolkit bridges theory and practice. So what we have done is paired each step with system considerations, the tools, the templates, and the methods that are needed. And also, trying to understand the complexity involved, but also how to navigate that complexity. Another objective is, as I said at the beginning, it complements the 12-step guide. So it's in no way, a standalone piece. It actually works alongside it to translate that guidance document into a structured systems-informed process. The fourth objective is to consolidate all the instruments into a coherent package. So when you get the document, it'll have forms, templates, checklists, all the assessment tools, everything with the logical sequence of planning and design, and the considerations of what the interdependencies are amongst each of those tools. There's a guide. The aim is also to guide the sequencing and application of the different steps to understand how and when each tool should be used, how to choose stakeholders, which stakeholders to involve, and what are the outputs of each stage. And then, of course, to embed integration and sustainability right from the design, thinking, and the planning stage. So this systems toolkit is for policymakers, planners, program managers, those who are responsible for the planning, design, and implementation phase. It's also for technical experts. So just thinking across the range of technical advisors and experts who are going to work alongside the team to make the SRS implementation possible. And then, of course, for development partners, donors, and implementing organizations to understand, well, what goes into different steps. And it also helps understand that it's not a very short process. It actually has to think through those different steps and the time taken to also bring people along through that design phase. SRS is a complex adaptive system, and we've written this guidance keeping this core principle in mind. And what I mean by saying that it is a complex adaptive system is that complex adaptive systems, like mortality systems, they're composed of many, many interacting agents. And if we think about each of these agents, their collective behavior produces an outcome that no particular single component can determine or predict. So we've just got to think that this is not a linear process, but it is a non-linear process. It is self-organizing. It has multiple feedback loops, and the system constantly undergoes adaptation to the different contexts, which are constantly changing. So as you know, you've gone through the planning phase or written the protocol and realized that there are so many interacting agents. There's community informants, field supervisors, there are data managers, there's policymakers, statisticians, donor agencies. Their behaviors are shaped by their local incentives, their norms, their context, the capacity, and that varies across settings and it evolves over time. So keeping this as a foundational principle, we thought through the different steps, and I hope when you see the document, you'd be able to appreciate this foundational concept. So this is just a figure to show how that SRS system, which is in the dark blue purple, sits within the national mortality data ecosystem, which may comprise of CRVS, HMIS, surveys, community reporting, etc. So there's a larger data ecosystem in which the SRS sits. And on the right, you would see these five aspects or characteristics which we have considered. So there's interdependence, there's non-linearity and emergence, that each decision that someone takes can actually produce a disproportionately large or an unexpected outcome downstream. There's adaptation that will occur throughout as different agents they adjust their behavior to changing conditions or to different local conditions, which may produce unintended consequences. Feedback loops is another characteristic that we have thought about. And then finally, embeddedness, that SRS is nested within the national data ecosystem, which is shaped by legal frameworks. It's shaped by statistical capacity and political priorities, amongst a number of other contextual features. So just keeping that in mind as you plan through the SRS system is an important foundational aspect. So when we thought through that system lens for design and planning of SRS, what we did was we looked at the 12 steps of the implementation as written in that Johns Hopkins, the authors from there have spelt it out really beautifully. What we focused on is the first 6 phases, the conception and the planning phase. The toolkit focuses on steps 1 to 8, and the idea is that these steps provide the foundation upon which steps 9 to 12, they build on the first 8 steps. So we focused on those 2. And what I'm going to do is just go through those 8 steps very quickly, given the time that we have. But my hope is that when you review the document, you'd be able to look through all the steps and work through those different components. The way we've formatted the report, each step has an aim, a rationale. We have talked about the systems lens. What are the interdependence? What are the different resources that one needs to think about? The fourth point is the system requirements and considerations. What are the expected outcomes? And a key system message for each step. And that's how we've built upon those 8 steps. So I'll start off with the first one, and I've kept it very brief. So the first one, as we said, was is building support. So the aim is to establish governance, ownership, and financing foundation for SRS. There are certain system requirements that we've identified. Again, as I said, it's completely aligned with the 12th SRS steps. So a lot of it has, it works quite well with it. But what we have added, and I've not put this in the slide over here, just thinking through the system considerations. So within the first step, the idea is to identify institutions involved, identify the leadership, establish the ownership and accountability, especially when there are multiple institutions involved. We just need to identify who the owner or who would be accountable for that entire process, map the stakeholders, and initiate financing discussions around how this system would be maintained over time. So not as a one-off activity, but thinking through sustainability of the program. The outputs of this step are an interview with stakeholder and managers, and we have linked that to the forms, Form 1.2 and 1.3, a stakeholder map and power interest grid. Again, each of these will be linked with the form, so it'll be easy that one document will have everything, all the resources in one place rather than going from different resource kits. You will have a defined institutional arrangement and governance setup, an SRS technical working group, a clear funding landscape, and resource mobilization. So the key systems message for step 1 is having a governance decisions create path dependencies that constrain every subsequent choice. So design the system, not just the approval process. Think through all those who are going to be involved or impacted by this process. The second one is around situational analysis, where one needs to map the existing mortality data ecosystem before designing anything new. So obviously it will entail understanding what all is in place from the largest to the smallest possible subnational system, and examine system interdependencies. Now, this is not just looking at CRVS systems, but also looking at health, also looking at other, academic organizations that may run some demographic surveillance sites or some surveys, but just mapping everything and also considering historical factors, because the SRS actually may be impacted by some of the historical factors of the mortality data landscape. Assess whether there are any effective feedback loops, what can we learn from them, and also think through, in terms of an equity lens, whether people are excluded from the current mortality data systems and what can be done to ensure that no one is excluded or everyone is represented adequately within this new system. The outputs are a range of forms, which is an inventory of mortality systems, interviews with the different stakeholders, an information architecture analysis, process map of things as is, so in terms of the workflows, a completed situational analysis report, and also legal or regulatory review report as required by the country. So the idea over here is that you cannot design or modify a system that you do not understand. So over here, the situational assessment would guide the team to really understand the context and all the players involved, to understand what the interdependencies are, where the feedback failures are, and that will help us shape or undermine what we build next. Step 3 is around surveillance design and data collection strategy, with the aim to translate the findings from step 2 into a coherent SRS design integrated within the existing systems. So over here, we go into that design phase where we define what the scope of this mortality system is, what are the indicators, the data collection approaches, and the idea is to align with national priorities and ensure that we don't build, new indicators which are not needed, but we try and align with global monitoring frameworks. Recently with the SCORE's next report, I think wherever alignment can be possible with the global monitoring frameworks, that would be an added advantage for the country. Review any parallel data collection activities and see where one can, align or share resources, and of course, embed quality assurance mechanisms. So the output over here is designing a workshop using the situational assessment evidence from step 2, refine the process maps. So, we had the as-is maps, but now to refine them to show what would it be, what would it look like in terms of the data flows. Use the strengths, weaknesses, opportunities, and threats to prioritize the feasible design, and use a system design template. So just remembering that integration is not an add-on, it is the design. If we run parallel systems, we just add burden without adding any value. So design interoperable and quality loops from that first sketch of SRS design. Next, we look at statistical domains, sample designing and sample size. Here, the aim is to define who and where the SRS will measure, ensuring estimates are representative, powered, and credible. Here again, the idea is to establish a robust sampling frame, aligned with the most recent census, making sure again that there is representation which is operationally feasible. Balancing what is feasible, thinking through the budget as well. That's why we looked at it in point number 1, to make sure that whatever is done is feasible, it's sustainable and maintained for the country. And also plan to update the sampling frame regularly. And again, as we mentioned earlier, have that as within the design, so that one gets back to the design regularly to see where we go from a certain point. The outputs over here are sampling design templates, sample size calculation worksheets, technical validation from the National Statistics Office, or alternative sample design report template. And the key systems message is who you count shapes what you see. So make sure that we include populations who are usually excluded from surveys, from larger surveys or larger systems. So just make sure that we don't leave anyone behind in the statistical design and sample size. Step 5 is around the tool and manual development, testing, and ethical clearance. The aim is to adapt, test, and approve the instrument and operational procedures that the field team will use. All the tools that are developed should be pilot tested for a certain period of time, and the pilot should be done as it would happen in the field. So allowing us to learn the lessons. Like if we draw in too much of an artificial environment in the pilot, we won't be able to pick up any flaws of the system. So allow it to be piloted as close to the ground reality as possible. And lessons from the pilot should be reviewed with the stakeholders. So noting that these things will take time and we shouldn't ideally rush through any of these. Learning the lessons from the pilot and reviewing them, the next step is to refine the tools and the processes. And of course, wherever needed, please take the necessary ethical and regulatory approvals before any data collection. The outputs over here are finalized tools, operational manuals, the report of the pilot, the revised tools, and all the ethical and regulatory clearances. Step 6 is around digital solutions and IT architecture. The aim is to design a resilient, interoperable digital infrastructure that supports data flow and real-time feedback. Again, I can't stress this enough, that the digital solutions are part of an interconnected system. It has to speak to the other systems and not be a parallel system. It should be designed for resilience with inbuilt mechanisms for M&E. Plan for hardware and software into the future, because these are super costly and complex to replace. And also think about the solutions from a perspective of equity and accessibility. Can the health workers use it? Is it user friendly, or do they need constant training, or will they end up collecting data on paper and then someone else would have to enter the data? So just thinking through that, and this also would require a bit of workshopping. The system must support continuous learning and long-term viability. So the outputs over here are information flow diagrams and system architecture documents, again linked to the forms, digital requirement checklists, like what are the hardware and the software required, data flow diagrams, dashboard templates for mortality indicators, remembering that this is not just a data collection exercise, but also an M&E exercise and also a feedback exercise, wherein the person who collects the data should also know what's happening to the data that they collect. So the key system message over here, that the technology chosen for convenience today becomes infrastructure tomorrow. Please prioritize flexible open standards and feedback mechanisms over the cheapest or most familiar platform. Next step is around equipment and supplies. The aim is to identify costs and plan procurement, especially where resources are shared across systems. Over here, the idea is to identify everything that is required in terms of equipment and supplies, leverage the existing infrastructure. So if we are working within health or CRVS systems, just understanding what the infrastructure is and making sure that we use those systems or leverage them. The outputs over here are equipment and supply inventory, completed costing tool to estimate initiation and recurrent costs for procurement, fuel maintenance, connectivity, etc. So this step basically includes identifying and procuring and maintaining the required equipment supplies for SRS to make sure that all the arrangements are planned for and are made, including the roles, costs, and responsibilities. And to the final step, and I guess the most important one, is around human resource recruitment, training, and capacity building, with an aim to ensure that the SRS is staffed, trained, and there is institutional capacity for sustaining performance over time. Again, this is something that we see very often. Once the pilot phase is over, governments do not take on the human resources, or the salaries for human resources. So plan for the HR and institutional capacity to implement and sustain the SRS over time. Have a comprehensive list of the human resources involved. What are their roles, their responsibilities? What are their accountabilities, their competencies, and funding? The recruitment process should be established for data collectors, supervisors, and technical staff. So think through all of those processes required, including IT staff who would provide support to the digital infrastructure for SRS. Invest in long-term capacity building. Again, there's a lot of turnover of people. If there is a lot of turnover of people, thinking through, well, how will training occur on a long-term basis? Do we need to embed this training in some of the technical schools? Or how would on-the-job training take place? Do we have e-learning? So just thinking through long-term about what the HR processes would be like. So the outputs over here are human resource plans and budgets, terms of reference for all the roles at various levels, training and capacity building plans, including refresher training, capacity building for sustainability, and supervisor and quality assurance mechanism. The message over here in terms of systems is that capacity is a system property, not an individual one. And sustainability requires institutional memory, structured supervision, and feedback mechanism that persists beyond any individual's tenure. So what I've done is, in a very short period of time, taken us through steps 1 to 8 of the 12th step process. So we've touched upon the first phase, the conceptual phase, and the planning phase. I will hand it over to Maryam now, but thank you so much for listening, and I'll stay till the end to answer questions. Thank you.
Thank you, Rohina. That was very comprehensive and very good overview of the 8 steps that we are focusing on. So I will just quickly share my screen, and then in the end we can have the discussion. So Patricia, if I'm going over time, please tell me.
You're good. Okay.
Yes, please flag that to me. Probably I will not see the time. Do you see my screen?
Not yet.
Okay.
It's
Now?
I think it's now. Yeah, it's loading.
Okay.
Yeah, now.
Okay, Great. Hi, everyone. Hi again. My name is Maryam, and I will present two of the other deliverables that we have from the first phase of the planning with 6 countries. And this would be on behalf of the bigger team from the countries and the technical assistant teams. I will focus. So from Rohina's presentation, we are all familiar with the situational assessment, how important it is, and also we also touched upon the importance of business process maps on different stages for SRS. Now I will present in more details 2 other products from this project that are more linked to these 2 steps. So from the essential process maps for sample registration system, this is a toolkit of generic process maps showing how an SRS works end-to-end from an event being detected in the community to data being used for decision-making. Sorry. It's meant to be adapted and not prescribed. So what I'm presenting here is just an overview, a very high-level overview of the process maps for different process maps for SRS. And I will briefly explain it, and then you will have access to the final product, hopefully very soon. SRS isn't a standalone solution, as Rohina mentioned it several times in her presentation correctly. So it's a chain of interlinked processes across community, facility, registration, and statistics actors. So you already see like there are so many actors in play. A generic overview process maps could help us give everyone the same end-to-end picture to work from. So this would be just a starting point for the discussions. It's deliberately generic, the process maps that we developed, and they are high level, as I mentioned, because they are a reference model and a conversation starter. The real value comes when a country adapts it to its own context, like for a pilot, for looking at the contextual differences between rural and urban settings, and depending on their own institutional capacity that the country has. We identify 5 core processes in sequence, each producing a milestone or what we call key output that unlocks the next sub-process. So here in this graph, you can see, for example, the sub-process number 1, baseline household enumeration, and the milestone for this process would be surveillance population being established. And then it will lead to the next sub-process, event detection and notification, and the milestone is event notification recorded with SRS. This leads us to verification and registration sub-process, and the key output is event verified and registered with SRS. And then we would have cause of death determination and verbal autopsy. The outcome would be probable cause of death being assigned. And then it will lead us to data management reporting and use, and the key output would be data analyzed and used for decisions, and also the feedback loop, which is going back to the data collectors. Here, the mortality is the tracer event, but the same skeleton fits other vital events like birth. Here we can see the different types of processes that we covered in these sub-processes. So just to have like an overall picture, we are including core processes, meaning the main flow through from vital event being captured until it's being reported and used for decision making. Support processes, and here we have the operational and technical foundations like trainings, tools, logistics. And we also have management processes. These are the oversight, the coordination, quality assurance, feedback functions that are supporting, that are also like management and supporting processes for core processes. So with this information, we developed an interactive adaptable tool, including 5 SRS process maps, editable BPM source file, which will be available for countries to use it to adapt. And here, let's have a look at the standalone tool that we have here. It's called Essential Process Maps for Sample Registration Systems. You will have access to this page very soon, and then there might be some changes by the time that you are watching this recording, but the overall structure would be similar. So here we have the introduction of what this tool is for and what it includes, and then we have this information about different sub-processes that we are including. By clicking on each of them, it will lead you to the more detailed process map step here. So for example, for baseline enumeration, and that goes the same for all of these steps, you will have the process map. You can save it with different formats, PDF, as an image, or as the editable BPM version to use with BSAGI modeler. You will have a process description, which is the core processes, milestones, practical notes from the experience that we had with the different countries, support processes and management processes, and here is a summary of the key activities. Also, here in the homepage, you will have the BPM guide that will help you to read the process map. So even if you are not familiar with business process maps, these symbols, they will help you read one. So now moving on to the next topic of the deliverables, about the situational assessment. So 6 countries conducted situational assessment of their mortality information systems to inform SRS planning, including Senegal, Mali, Ghana, Kenya, Tanzania, and Pakistan, and they have presented their findings separately in previous webinars. Today, I will present the synthesis of the cross-country synthesis of the situational assessment findings on behalf of the partners who contributed. Countries in the planning phase had what they had in common was that they had incomplete vital statistic reports, meaning that a substantial proportion of death and causes are never reliably captured. Alternative sources exist but are fragmented. And this is the gap SRS meant to help to fill, but only if it's introduced thoughtfully, which is why each country started with a situational assessment to understand what they already have, what is the ecosystem of mortality information system, and how SRS can fit into that system. So overview of the 6 countries, as I mentioned, we have Senegal, Mali, Ghana, Kenya, Tanzania, and Pakistan, and their fantastic teams. They used a common approach, so the findings are comparable while still adapting to their own context. So the tools that were provided to them, it was adapted to the context. And they followed these steps: key informant interviews, stakeholder workshop, field visit, and document reviews. So this was conducted by the country teams. And then we use inductive and interpretive thematic approach to extract some information from the assessment findings. We compare patterns across countries and interpret those patterns for informing SRS design. And the findings. Interpretations were iterative, and the final structure landed on 2 domains, which are mostly on the governance and operation sides. Starting with governance domain, we found that every country has the legal foundation. Almost all of them, they had that, but laws stop at registration and do not define how facilities, mortuaries, cemeteries, police, and others, they actually connect. Responsibilities are fragmented, and no single institution owns the full pathway from death to data being used. Health and CRVS systems do not talk to each other in many of these settings. Data governance is not very strong, and financing is fragile and mostly dependent on external resources. And the recurring gap that we identified was not the absence of law, but their limited translation into working roles and processes. For operations domain, a death, we identified that a death can be observed or recorded in one place, but never make it to the national statistic. So, and also notification was the weakest entry point, and it leaned on the grieving families and also informal stakeholders like community health workers, village leaders, who are not in the formal registration and notification processes. As I mentioned, in the legal framework, one of the gaps that we identified was that these stakeholders who have a main role in detection of the death, they are not being institutionalized. And just to have like an overview of how how countries came with this finding was countries, they have done social network analysis, and this is just an example from Kenya, Tanzania, and Pakistan. And you can see that the family has a very central role in connecting different stakeholders. Also, informal actors had very central and bridging roles between stakeholders. So the reliance on families is kind of a red flag for SRS, for a mortality information system that shows a structural vulnerability, meaning that the system relies on the family to start or continue the process, and basically continuation of the process depends on the decision of the family to continue or not. Let's move on to the third finding, which is about quality assurance, which is siloed by program-specific quality assurance. There was no comprehensive quality assurance for mortality information systems. And the capacity, the uneven capacity, including human resources, digital readiness, even within the country, in rural, urban settings, remote areas, and in conflict settings, there were quite different stories. So the message from this domain was the data exists somewhere, it's being captured, but it doesn't move to the national statistics. So overall, from these two domains, what we had was that the problem is not the absence of data source, it is the weak connection between the stakeholders. So the fix is not to collect more data, basically, it's connecting what's already being collected, which might not be the case for many other countries, but from these 6 countries, this is what we identified. Now, translating the insights into the design principles for SRS, SRS should be planned for system fit. It should be complementary, building on existing assets in the system. Like we mentioned, the informal stakeholders on the notification pathways, which can be very helpful when designing SRS to think about how we want to use this. Context sensitive, SRS needs to be context sensitive, taking into account cultural norms. Different religions in different settings might have different norms for burial, and the diversity of the population. And this needs to be being accounted for as a system input, not just the contextual background. And choosing and adapting cause of death assignment approach from MCCD verbal autopsy and needs looking at feasibility, acceptability, and how it's going to be linked, as Rohina already mentioned. These are very important to think about if it's going to be acceptable by the population to have means, or also the feasibility of the sample of conducting verbal autopsy and all MCCD in the sample areas. And now another findings from the synthesis that came was how to use the different assets and resources that are already in the countries to build SRS on. This is an illustration of how countries could use these assets to improve SRS. We adopt a Swiss cheese model from Safety Science. And here, each layer of the cheese, it has holes. It means like these events like death, they could just be missed from each layer. But if we stack all these layers, then the probability of capturing the event death is higher. So we identify that in countries, there are opportunities, the systems are fragmented, but the death or the event is being detected somewhere. So if we have all these layers, if we use these layers together, then then we can increase the probability of notification of the event. So here we start with active notification household visit, which is done through SRS. And then the next step would be cross-validation through routine contacts. And here we have community health workers, village leaders, and facility staff, which from the situational assessment reports, all countries, they mention that they have these resources. So this is a very good resource to cross-check. And also integration or linkage with existing information systems. So another point that Rohina was emphasizing was about interoperability of the system. And this is why how SRS can use this opportunity to not only improving the completeness for SRS, but also as a result, improving the quality and completeness of other resources like CRBS in the country. So for
Maryam,
takeaway,
you have 5 minutes left.
Thanks. This is the last slide. Thank you.
Perfect.
The 4 takeaways, main takeaways from the situational assessment. The gaps are structural. It's about connections, not just the outcomes like not having good information. SRS earns its place as a complementary to the mortality system that already exists. A system approach that builds on existing assets is feasible, and I would say is essential. Each country can use its own situational assessment findings as a system input for designing and tailoring SRS to its context. And the assessment isn't just a preliminary step, it's each country's design brief and helping countries identifying inputs for SRS design. And some of the existing assets here for the countries are mentioned here. So I would just skip this part, and I would like to thank all of the contributors, country teams from Senegal, Mali, Ghana, Kenya, Tanzania, and Pakistan, all technical assistant partners, and Gates Foundation for their generous support and funding. Thank you so much, and over to you, Patricia.
Thank you very much, both Maryam and Rohina, for the fantastic presentation, and even more so for these resources that I believe will be very, very helpful for the country teams working in SRS and throughout the different phases. We have 4 minutes left, so maybe I will open the floor for one question if there's one in the room. I believe we have time for 1 or 2 questions. So, or even like share some reflections. As Maryam mentioned in the beginning, these are not finalized yet. It's almost there. So also, if you have any points that you would like to raise, please feel free. Okay, maybe there is no comment or question in the room.
Well, sorry, this is Jason Bay from the Mali team.
Yeah.
So we're currently in negotiations with a lot of potential funding or co-funding partners. And is there any sort of, I guess, guide or any sort of resources out there that will, I guess, kind of guide us through those, like how to start negotiations, kind of a laundry list of like the usual suspects in terms of co-funding partners that historically have, I guess, funded this space so that we could, perhaps see what the relationships are. I mean, we did do the resource mobilization plan, but if there is a kind of network-wide list of potential funding sources, I think that would also be really, really beneficial. Over.
Okay, thanks, Jason. I don't believe there is one resource that kind of like gathers all the actors that might be able to fund, future phases of the grant or of SRS. Also because it's somehow country specific or like region specific,
Absolutely.
even though I am aware that there are like some, more like global partners. And I believe that probably like with the exercise that we did at the beginning as part of the situational assessment, like the funding landscape, that was kind of like the chance to, or like the idea to kind of like identify those partners.
Sure.
So
Oh, yeah, and it
beyond,
was, yeah, exactly. That was done, and it's just, it's always good to have more, I
yeah,
guess.
yeah, no, I understand. If so, there's short answer, no.
Yep,
There's not
sure
such a
thing.
resource that gathers that. They're like different resources as you did. There's the investment pitch that would also help, in how to communicate with the
right.
partners or like pitch the idea. So different resources. If you think there's anything else that could be helpful as such a resource, I don't know. Maybe you can also let us know and see what we do. But I think probably starting with the funding landscape, that would be kind of like the starting point, I would say.
Absolutely, yeah.
Mhm. Okay, thank you, Jason, for raising that. So we are close to the end now. So I would just thank again Maryam and Rohina for sharing these valuable resources and the insights, and also for the participations throughout today's session, but also the whole webinar series. And we really hope that these products will help us provide some practical support, which I'm sure they will do, to the countries as they continue strengthening and implementing, hopefully, their SRS and the broader mortality systems. As we mentioned, they will be shared with the country teams and also made publicly available to the broader community. We will announce the dissemination channels and access arrangement as soon as the products are finalized. So you will hear from us, and thank you again for your participation. This all comes from also from the hard work from the countries. So thank you to the country teams, and again to Maryam and Rohina for putting it together, this fantastic overview. And yes, stay connected and have a great rest of the day, everyone.
Thank you.
Thanks,
Bye.
everyone.
Bye, everyone.
Bye.